1 in 8 women will develop breast cancer in her lifetime. And if you think you're safe because no one in your entire family has ever been diagnosed with breast cancer, think again. Because 85% of women diagnosed with breast cancer have no family history. Oh, she's sneaky. Breast cancer deserves to be beaten. So join me, peaceful people. Breast cancer occurs when the normal breast cells make a change and start growing unchecked and out of control. It can happen in both women and men. Yes, men can get breast cancer. So many celebrities have been very open about their battles with breast cancer, such as Robin Roberts, Cynthia Dixon of Sex and the City, the singer Sheryl Crow, and Julia Louis-Dreyfus of Seinfeld. When breast cancer is detected early and treated, it is very often curable. In fact, breast cancer deaths have declined by over 1/3 over the past 3 decades due to screening, early detection, and better treatments. What are the symptoms of breast cancer? Well, the whole point of breast cancer screening and early detection is to detect breast cancer before symptoms ever develop. But when symptoms do occur, they can be as follows: breast hardness or a lump in the breast, which can be detected by self-examination or examination by a physician. The breast may also change size with breast cancer. You can get breast swelling. One breast may become larger than the other breast. One breast may hang lower than the other breast. Another symptom, skin changes. If you have breast cancer, the skin around the cancer can change. It can become hard, thick, it can get dimpling or look something like an orange peel, an orange skin. Breast pain, even though breast cancer is usually painless. Also, nipple discharge, or even a bloody discharge of the nipple, especially in someone who is not breastfeeding. Nipple changes can be symptomatic of breast cancer as well. Nipple thickness, nipple itching, nipple scaling. An inverted nipple can be a symptom of breast cancer. Also, lumps or swelling in the underarms, the armpit, can be a symptom of breast cancer. And a late symptom of breast cancer could be skin breakdown or erosion, ulceration at the site of breast cancer. Again, the point of screening is to try to catch the breast cancer before you develop symptoms. But if you have any of those symptoms, you must consult your physician and find out if you are at risk for breast cancer. Breast cancer screening. Screening is one of our best weapons in the fight against breast cancer. Self-examinations used to be recommended every month. However, self-examinations have become a bit controversial. No studies have actually proven that self-breast examinations plus mammograms are better than mammograms alone. And no studies have actually proven that self-examinations decrease the death rate from breast cancer. That being said, I personally have taken care of patients who have discovered breast lumps and who have discovered their own breast cancer through self-breast examination. So if you do make the choice to do self-breast examinations, it is typically recommended that they are done monthly. You can do them lying down flat. You can do them while you're in the shower. And the key is to make sure that you learn how to do it correctly. Consult your physician. You want to move and touch all of the breast tissue, all of the nipple tissue. Feel for hardness, feel for lumps, look for skin changes, feel in your underarms. Again, consult your physician and have that discussion about self-breast examinations. And if you do choose to do them correctly. Physician examinations. You should be visiting your physician routinely and talk to your physician about examining your breast. Your physician, of course, will be proficient in examinations and detections of signs of breast cancer. The mammogram. A mammogram is a specialized x-ray of the breast that is meant to detect breast cancer very early, even before symptoms have the chance to develop. You must consult your physician to find out when you should have your mammograms. Many physicians recommend that ladies have mammograms starting at the age of 40, but depending on your risk factors, your family history, you may need to have your mammograms done at an earlier age. Some physicians recommend that mammograms are done every year. Some recommend that mammograms are done every 2 years, depending on the patient. At any rate, it is important that ladies have mammograms done routinely in order to detect breast cancer early. In addition to the mammogram, there are several other diagnostic screening and monitoring tools for breast cancer, including breast MRIs, breast ultrasounds, CAT scans, chest x-rays, bone scans, biopsies. Consult your physician to learn more about these options. As far as the treatments for breast cancer, they are getting better and better, and they can include surgery, chemotherapy, radiation, hormone therapy. Again, you must consult your physician. What is the purpose of genetic testing? Genetic testing tests for genes that may put you at a higher risk for developing breast cancer. The BRCA genes are commonly used to test for breast cancer risks. The BRCA1 and the BRCA2 genes. If you test positive for a BRCA gene, you may have up to a 65% lifetime risk of developing breast cancer. For this reason, some ladies who are found to be positive of the BRCA gene make the very personal choice to have bilateral mastectomies. They remove all the breast tissue from both of their breasts to try to decrease their risk of developing breast cancer. Some celebrities who have shared this very brave and bold choice include Angelina Jolie, as well as Christina Applegate. This ends my general overview on how to fight breast cancer. Being screened so that there can be early detection and early treatment is the key in the fight against breast cancer. Remember, each patient varies, so make sure you consult your physician and find out which screening tools and which treatments are best for you.